you're pregnant right now, planning on becoming pregnant, or know somebody who's pregnant, this may be for you. I know a lot of women struggle with vomiting, especially in the early part of the pregnancy. They call it morning sickness, right? But it's really not morning sickness because it can happen anytime throughout the day. And the sad part is that it usually lasts for the first 3 months, which is the first trimester, but for some women it lasts throughout the entire pregnancy. Now this can be very debilitating. It can make you feel so sad about the pregnancy and just about your health in general. So if you find that probably nothing is working, these 3 things are clinically proven to work and you can give it a try. Just talk to your doctor first. Dr. Kim Sommerville, your general practitioner and clinical nutritionist, and this is Simple Sommer Naturals. The first thing that we can do to help reduce vomiting in pregnant mothers is use ginger. Now, ginger is usually known as an anti-inflammatory agent, but it also helps in digestion and is also called an anti-emetic, which essentially means it helps to reduce vomiting, right? So the way in which you'd want to use this is by cutting our raw ginger, and that's usually about 1 inch of ginger, and you boil that in about 2 cups of water, and you can have that throughout the day. Studies have been showing that when you're using ginger for your nausea and vomiting in pregnancy, it tends to help once you have ginger tea for about twice a day for at least around 4 days to 1 week. The only side effects that I have found in studies have shown are about diarrhea, but some articles do notice that there may be an increased risk of bleeding. I haven't found that in the actual studies, but that is something to note. And of course, speak to your doctor before you try anything to help in terms of your pregnancy. Next thing that is proven to be beneficial for nausea and vomiting in pregnancy is the use of acupuncture or acupressure. Now, what this is either using pressure with your thumbs or fingers, or using specific needles by acupuncturists to pinpoint certain areas in the body that reduce vomiting. Usually safe in pregnancy, but what tends to be shown in studies is that it reduces the hospital stay for women who have severe episodes of vomiting, and it also reduces the need of antiemetics, which are prescribed medications for vomiting. So we find that these women tend to have a much better outcome with their pregnancies and with their overall health when they are using acupuncture for their vomiting. Now, again, speak to your doctor. I'm always going to say it, but if there's something that needs to be tried, then acupuncture may be right for you. So the last thing that we can do to improve nausea and vomiting in pregnancy is to think more along the lines of psychological and social factors. The point of it is that the severe vomiting in pregnancy has many different causes. It's not just because our hormones are changing in pregnancy. They have found that women who may have unplanned pregnancies, the ones who may have anxiety and depression in pregnancy, and those who may have a psychiatric disorder tend to have a higher risk of having moderate to severe vomiting. So it stands to reason that helping to basically give relaxation techniques may just aid in the vomiting and the nausea. So what a study had done was provide a psychoeducational program which essentially taught breathing techniques, relaxation exercises, nutritional modifications, lifestyle modifications, and trying to accept emotions and guiding imagery to help women with the severe vomiting. And what they found is that when they did these sessions and checked them back in about a month, they found that the group that actually had all of these imagery and all of these relaxation techniques had much better outcomes when it came to their vomiting. It was much reduced and they had much less use of the antiemetics or the anti-vomiting medications. So if it's possible for you to find a therapist or to ask your doctor what they would recommend in terms of relaxation techniques And in terms of ways to help with your emotions, this may just be one of the factors that we didn't consider when it comes to treating vomiting. For me, I did not have vomiting in pregnancy really, but I had a wonderful program at the end of my pregnancy called hypnobirthing. It sounds really hippie, but essentially it's just teaching about pregnancy as well as teaching relaxation techniques to help at the time of labor. But I believe that this would be effective for persons to use at the start of the labor as well, to learn more about pregnancy and to just get your nerves at ease as you go through the entire process. So let me know in the comments, have you used anything for vomiting and pregnancy, or do you know anyone who used vomiting, who used something for their vomiting and it was effective for them? Please let me know if you have any questions. Also let me know in the comments. I'm Dr. Kimberley Sommerville, as I said previously. If you want to work with me for nutrition in pregnancy, you can catch me on my information here. And yes, this is Simple Sommer Naturals, giving you simple nutritional advice for your daily life. Take care.